Everybody, I'm Dr. Darin Collins, Director of Animal Health Programs here at the Woodland Park Zoo. And welcome to our zoo hospital. We have an excellent team of zoo veterinarians, veterinary technicians, and hospital keepers. And we need that team because we have nearly 1,000 patients here at Woodland Park Zoo, each of which gets individualized patient care. And each spring, with the addition of new zooborns, neonates as we call them, we anticipate their birth and we develop a birth management plan. And in 2020, since the zoo has been closed, you may have actually heard about the zoo newborns, the baby gorilla, the red panda twins, the wallaroo and wallaby joeys, the mountain goat kid, and the tapir calf that was just born. Each new baby is a welcome addition here at Woodland Park Zoo, and bringing a zoo baby into the world may not be as simple as it sounds. So let's talk about a birth management plan. Each plan is individualized for that species and that female. We anticipate the birth because we may have actually seen breeding behavior, or we know that there's a weight gain, or we're seeing some behaviors of the female that might indicate that she's pregnant. Ultrasound to diagnose a pregnancy and help determine one fetus, two, or more. And we also use a lot of video surveillance. Oftentimes, infants are born at night when we're at home, and we log into our smartphones or our personal computers and actually log into the video surveillance cameras and monitor a birth that way. And we do like to watch so that we can intervene if necessary. 9 times out of 10, we don't have to intervene. And we like to watch that process. We look for what we call normal, what we've seen before in terms of appropriate maternal care. We want to see that the infant is possibly standing or moving. And oftentimes there's nursing that follows very quickly after birth. And we're looking for that also. We're looking for that maternal-infant bond to be established so that we can take a breath and stop worrying, because we all are on edge for each and every birth here. And the birth management plan is an outline of expectations for what follows the birth. And oftentimes there's a first 24 hours of direct observations, looking for nursing, and sometimes that involves a neonatal exam. So the red panda twins, actually, that's Hazel. Hazel has had birth before, and she was an A+ mother, and we were able to see the birth on camera, and we were also anticipating that Hazel used one nest box. She chose to use another nest box, and some of which meant we didn't have cameras on them. In that case, we actually did an early on hands-on exam to make sure the cubs were nursing and they were within normal expected body weight ranges. We also checked the heart and lungs. We will oftentimes mark one cub versus another cub so that we can check them as individuals. And when they're appropriate age, we start the vaccines. For the most part, we're looking for the eyes to open normal. We're looking for all the right body parts. We're looking for the cubs to have normal development phases for that species at that age. And the birth management plan typically ends about the time of weaning. So that's a quick synopsis of the Woodland Park Zoo birth management plan. We've been doing these for upwards to 20 years. All the work up front is well worth it as we invest in each and every birth here at Woodland Park Zoo to give that neonate the best possible outcome being raised by its mother. Thank you so much for joining me here today. Hope you learned a little bit, this behind the scenes look of the birth management plans and some of the individual births here at Woodland Park Zoo this year. We look forward to seeing each and every one of you this Friday at Jungle Party.